Hi, I'm Andy Rosenkrantz, Editor-in-Chief of AJR, and I'm here today with Dr. Jeffrey Sachs, Associate Professor of Radiology at Wake Forest, and he'll be discussing with us his recently published AJR article on CT scanner energy consumption. Dr. Sachs, thanks so much for being here.
Dr. Rosenkrantz, great to see you today, and thanks for inviting me.
As context, in this study, you differentiate net scan versus idle state energy consumption. Can you explain for us what each of these represents?
Yeah, sure. So in simple terms, the net scan you can think of as the period of time where the scanner is actively emitting radiation energy for the purposes of image acquisition. So it's that time where we're actively acquiring the helical images from a CT scan. Whereas the idle state is really all that time in between. It's all that after the end of the helical scan, when the patient's being taken off the table, when the tech is overturning the scanner, and preparing to bring the next patient in.
You installed a current sensor on one CT scanner at your hospital and used the sensor to calculate energy consumption. In the first part of the study, you imaged a phantom on the scanner with the sensor, and you show that net scan energy consumption is highly correlated with radiation dose. Why may this be important?
Yeah, that's a great question. So as an imager who is passionate about the environment and trying to do our part in terms of sustainability and actively trying to reduce our carbon footprint, we took a look at our CT scanner energy consumption. And when we tried to get a sense of how much energy the CT scanner was consuming, we thought, okay, well, we can install a current sensor on all of our scanners, but that's kind of expensive and time consuming and not the most efficient way to do it. Maybe there's a way for us to get a sense of how much energy our scans are consuming simply from the radiation dose report that we get from every single one of our patients. And so by showing a correlation between that energy consumption with the dose report, then we could use the dose report as a surrogate or a proxy to assess for any sort of intervention we might do in terms of radiation dose reduction and subsequently in energy consumption.
Then you looked at net scan energy consumption across all clinical patient scans in 1 year at your hospital on that scanner. And you combine that information with values from the literature about the number of scanners in the US, the number of scans performed in the US, to estimate an about 14.9 times higher annual savings in the US achievable from targeting the idle state consumption than by targeting the net scan state consumption. Any comment on that?
Yeah, so that's a pretty impressive number, I think, 14.9 times greater targeting the idle state versus the net scan. And so I think radiologists like me that are thinking about where's the bang for our buck? Where are we going to spend our time trying to reduce energy consumption and make a positive impact on the environment? Where is the savings? And so to me, that number tells me that there's a whole lot bigger target from the idle state. But number two, not only is the net scan a much smaller target in terms of energy consumption, it also comes with potential trade-offs, because if we reduce the energy we're consuming to scan our patients at CT, but by its very nature, we're reducing the radiation dose that we use, which of course has trade-offs in terms of image quality, for diagnosis, sensitivity, specificity. There might be need to repeat the scan, for instance, and of course that would be an unintended outcome.
So what is needed to achieve these improvements in idle state consumption in practice?
Yeah, that's a great question, something we're going to be thinking about over the next few years. I think certainly the vendors have a big responsibility here in terms of both providing scanners that have low power modes, off modes, but also not only providing those modes, but also providing the radiologists and other end users with the education that we need in order to utilize those modes. As we mentioned in the paper, there's even for scanners that do have such low power modes, they're pretty underutilized. So that's something that we and just the radiology community has a responsibility to learn how to use those on the scanners where they exist.
Dr. Sachs, thanks so much for coming and speaking with us.
It's been a pleasure. Thanks for the invitation.